Amisha, thank you so much for coming on Like Therapy. Welcome.
Yeah, of course. Thank you for having me.
Okay, so you are a pregnancy and postpartum exercise specialist. So today I really want to dig into both, what that means, what that looks like, why we need it, all of it. And we'll just kind of dig right in. So first, tell us more about what are the special considerations that you think about in these different stages of life? And, specifically, I know from looking at your website, just getting ready for today, you really guide people through connecting with their pelvic floor, and some more of their just kind of whole body integrations in these huge transformations, in both physical health, emotional health, and everything.
Yeah.
So let's start there. Tell us what it means to prioritize health and exercise in this time of life.
Yeah, so I work with pregnant and postpartum women or people, and pregnancy, postpartum, and beyond, or people just with pelvic floor dysfunction who are trying to navigate exercise. So a lot of times during pregnancy and into the postpartum stage, there really isn't any guidance on exercise. It's just kind of do what you've always done, don't lift over 20 pounds, et cetera, listen to your body. But a lot of people don't actually, they don't know.
What does that mean?
What does that mean? Yeah, they don't know how to listen to their body. Like they've never had this body. So we focus a lot on core and pelvic floor. So like during pregnancy, deloading throughout the pregnancy, and like really down training the pelvic floor. And then postpartum, we focus on re-engaging core, re-engaging pelvic floor, and rebuilding back strength and stability. And then people with pelvic floor dysfunction, exercising in a way that they're not, like having symptoms. So like not leaking, like if they're leaking, if they're having pain, like trying to figure out, okay, what are you doing? Like how can we work with that and help it?
Yeah, and not just like, okay, this is just life. This is just how it's going to be.
Yeah.
Which is, I feel like, a lot of the advice that does get given. First, actually, tell us more about when you say downloading, what does that mean? What does that look like? Because I think that can be really scary for a lot of people, because there's this overarching messaging of like, just do what you've always done, like you described before. Or like, yeah, if you're going to the gym, it better be all out or it's not worth it. And so talk to us more about, okay, what does that mean? And then how do you help people through that? Sometimes fear or just uncertainty about like, what does this actually feel like to download? Or is it download?
Deload, yeah. Deload and down train. So
Deload, both. I was like, I'm going to combine those two.
Perfect. So deloading during pregnancy is, as you progress trimester to trimester, as belly grows, like maybe starting to limit range of motion, subbing exercises to still get the same benefit. So like, I like to think about it as like, if I'm like normally like I'm squatting 200 pounds throughout pregnancy, that I'm going to deload that, right? So maybe like I start squatting 150, then I start squatting 120, then going all the way into a squat doesn't feel comfortable because of my range of motion, center of gravity, pelvic, like maybe some like uncomfortableness. So now I add a box and I do 100 pounds. So it's just guiding people through each trimester, so each trimester, like, download, train.
Yeah, like.
Yeah, just deloading through the trimester. And then for the down training, so down training the pelvic floor, a lot of times we have this, like, idea that our pelvic floor has to be strong. Like, we have to train for birth, right? Reality is, like, baby's coming out. Like, you can sit on the couch for 9 months and baby's still going to come out. But like I said, there's this misconception that we have to have, like, a strong and prepared pelvic floor. And really, a lot of us are walking around with hypertonic pelvic floors that are super tight. So down training, we use breath work and exercise to really think about relaxing our pelvic floor. So, and I really, like, throughout pregnancy, that's, like, the focus is, like, really learning to relax those muscles. But really in the third trimester, like, the goal is really relax, because the uterus, that's what's going to push baby out. And if our pelvic floor is super tight and, not able to relax, then that's where it's, like, almost fighting the body. It's, like, almost fighting the uterus. So that's what the down training is really helping, like, people learn how to relax. And then you mentioned the mental health part, and that is a huge part of, like, when people are pregnant and then into postpartum, like, it's almost like you lose your identity a little bit, right? Like, especially if you're, like, someone who, like, the gym is a huge part of your identity. It's like, oh, I can't lift heavy anymore. I can't go hard. And so part of my job is really helping people see, like, this is a season, right? Like, pregnancy is a season, postpartum's a season, and, like, we're going to get through it. It's okay to give your body, like, grace. It's okay to give yourself, like, that permission to step back and deload.
Yeah.
And it's okay to, like, be postpartum.
Yeah. Like, even hearing you talk about not only the value in, but, like, the teaching and guiding that it takes to help, people, humans, just learn how to relax, not just in general, but, like, relax certain parts of your body. So that requires so much. It requires being able to visualize and get in touch with different parts of your body.
Yeah.
Feeling like how to what does it even feel like to tighten and relax? Like, how does breathing, play into that? And just then the overall normalization of, hey, actually relaxing is really important.
Yeah.
And it's important to athleticism. It's important to, if the event that we're talking about is, your due date, or even if the event that we're talking about is, like, getting back to whatever your new normal is going to be after giving birth or after having a dysfunction of the pelvic floor. So, yeah, I feel like we just need to stay there for a minute, because that doesn't get talked about a lot in really any parts of life.
Yeah.
Like, there is this, I don't know if it's stigma or idea of relaxing just being like, there's only one thing we think of when we think of that. Or, if you were to say, okay, relax your pelvic floor, like, okay, but wait, how? And what does that mean? Because a lot of times, when someone goes and is learning how to train for something, there isn't the time to slow down and say, actually, there's a lot of value in slowing down and figuring out what that actually means.
Yeah. So what I've noticed with, with myself and with clients is when they actually take that step back, and I like to think of it as like laying a foundation. Like when they take that step back and they truly learn how to relax and engage the pelvic floor. So like, for example, if I'm like always in a bicep curl, right? Like, and you say, Amisha, I want you to pick up like this cup. Like, am I going to be able to pick it up? No, because like in order to pick it up, I have to like actually relax my muscle, right?
Yeah.
So I have to lengthen and contract. I like to think the pelvic floor is the same way. Like in order to actually contract and for my pelvic floor to actually be responsive, I have to have, because our pelvic floor, it's a group of muscles that sits at the base of our body, right? Like, or of our core. And just like any other muscle, and they need to relax and contract, lengthen and shorten. So if we never relax them, then we're not gonna be able to be responsive. They're not gonna be able to like effectively contract, right? And like we're just always holding. So if we're trying to jump, if we're trying to sneeze, and they can't relax, that's when we're gonna have that leaking and those other symptoms, right? So I like to think of it like that. And what I've noticed is whenever we take that step back with clients and we think about like laying a foundation, that transfers over like to so much. So now like, they're able to lift without peeing on their self, or, the pain that they were feeling, maybe they're not now. Like it just transfers over into so much. So maybe like they're able to squat more, because when we're like I said, if my biceps always like this, I'm actually weaker. I'm not able to lift. It's the same thing like if we are like always like just super like contracted and super tense, then we're not able to be as strong as if we do. That was like a really long way of like responding to that. But.
Well, it's so helpful because it addresses, I think, the actual, mechanisms and physical health, like true physical health thing. Like this is really relaxing. Being able to relax these muscles is part of physical strength, and like being not only just quote unquote strength, but like actually being able to function and being able to get, whatever goals you're trying to get to. And I think also it can be such a radical thing to talk about strength, health, working out, exercise in the context of, can you pick up the mug? Can you do what you need to do? Can you feel connected to your body in a meaningful way, rather than the often, here's how you're going to fit back in those jeans. Here's how you're going to, look, whatever, lose that 10 pounds. Like that is the messaging that our society unfortunately prioritizes.
Yeah.
And so just even in hearing you talk, there's a mindset shift, an emotional shift of, oh, wow, not once was it about losing X amount of pounds, but it's actually, I could approach this and go into it by saying, oh, I could actually learn how to contract and relax my pelvic floor.
Yeah.
And that could help me, lift up a car seat without pain or, whatever other symptoms that come. So I think, loved the long answer because it goes into all sides of this and why this is actually such a important and meaningful approach to athleticism, exercise, and even just new normal in a life transition that's huge.
Yeah. One thing you mentioned was, about like you said something about fitting into your jeans. And I do feel like there's so many people out there who are just really preying on the insecurities of like new moms because, you know, when we have a baby, like we have a new identity, again, we have a new body, and it's very vulnerable. Like it can feel very like scary and very like, oh, I just want to look like I did before. I want to be able to do what I would do before. And so it bothers me when I do, like you see like on Instagram or on wherever, like join this program and lose your mummy tummy. I just got like a little British with that, but lose your mom, you know, like tummy and like your mom pooch and fit back into your jeans or whatever it might be. And that's one thing, like for me, like I don't care if you gain weight, like, you know, like your worth isn't connected to, you know, like what your body looks like. I care about like you being able to move your body in a way that like brings you joy, and being able to do so like without like, oh, I just have to wear black because I'm going to pee all over myself if I jump on the trampoline with my kid. Or, you know, maybe you have prolapse and you're like terrified of jumping again. Like that's like what I care about. Like I really want to help people gain back the confidence and like let's figure out like why are you peeing on yourself and what can we change to like stop it, you know, or reduce it. You know, okay, you have prolapse, like what does that mean? Like how can we adjust your exercises to accommodate, you know, or and even like maybe lessen symptoms.
Yeah. Like that really just personalized approach and talking about what might be embarrassing or people have judgment or self-criticism or just kind of get told, maybe not even any of those things, but just get told like that's just the way it is without knowing that it doesn't have to be that way and it doesn't have to be lonely.
Yeah.
You can do it with someone. It can connect you to whether it's other moms or just other people going through having these symptoms when working out or when trying to exercise, or even not when working out, when trying to just do all the heavy lifting or running after.
Yeah, motherhood is like an exercise.
Yeah.
For sure. And I know whenever we worked together, you kind of mentioned as a college athlete even, like people were always like, oh, engage your core, but you're like, what does that even mean?
No, I'm glad you reminded me of that because truly I went through a lifetime of being an athlete, ended up a Division I athlete, and can tell you that when they said engage your core, I was like, okay, I'm still using my neck or whatever. But like I never could, and it's on me because I didn't, you know, speak up or anything. I'm not saying any of that, but it's like I just didn't really understand. I didn't really understand. Okay, great. I would love to engage my core. Like, how do I have time? How there's just a whole skill and education in basically interoception of like how can you visualize the core in this example and then actually not only visualize it, sort of sense into it, feel it, know what to think about to have it engage. And so something that was really cool about when you and I worked together was I told you about that and I was like, you know, I'd actually love to sort of take my time and go slow, and you were like, perfect, you're in the
That's
right
what we do
place.
Here.
And I remember, you know, just there were certain things that we did, like kind of laying flat on the floor and actually practicing like, okay, let's try all these different breaths, you know, visualize the umbrella breath or, you know, whatever it may be, or, you know, kind of visualize picking up a blueberry. Okay, now when I'm visualizing, it's helping me to figure out how to move those muscles. And that might be me. You might have, so yeah, say more if you have clients that, you know, learn more from learning how to visualize these like muscles and functions in our body, or if there's clients that benefit from, you know, okay, what if we just are in a different position? Like if we're against the wall rather than being on the bench press or whatever, like, are you going to be able to actually feel something different?
So yeah, I'm really glad you you said that, because a huge part of it is like, we can't, like, you know, I mean, don't put it on yourself. Like if as coaches, we are giving blanket statements like engage your abs. Yeah. Or engage your core.
Like, okay, great. What? I don't know how to do that.
Yeah, but no one ever like actually teaches you how to do that or what that should feel like or, you know, any feedback. Then, I mean, that's not on you, right? But that's like such a huge part, is like every single person is an individual. And so I can't just be like, pick up the blueberry with your vagina. Yeah. Sit it down. Yeah. Engage your core, engage your pelvic floor. Like, what does that actually mean? What does that look like? And how, you know, what helps each person with that? So like you said, there's certain cues like that help people. Like sometimes it's the blueberry. Yeah. Sometimes it's imagine an elevator going from your vagina all the way up, you know, and out. Sometimes it's bring your hip bones together. So everyone, and then the position, some people like you with your baby laying on your chest, you were able to actually like feel that engagement a lot better. Some people, if they're in all fours, that actually helps them. So it's just everybody is a puzzle. Yeah. Everybody is an individual. And it's just figuring out like what are their tendencies, what actually helps their brain make the connection. Yeah. Yeah. We do have to talk about that piece of it too, that like you have set up your practice so that you can bring your baby, and not only can you, but actually incorporate it and see like, you know, that is a whole, I mean, it's so interesting how communicating almost with the body first instead of just with the mind, like, I feel like is so helpful. Like, okay, it is fascinating that, okay, lying on the yoga mat with my baby on my chest, somehow I am able to interact a lot more with that like what does this feel like? What, you know, where is this breathing going? And like, I mean, even just to maybe a shout out to the listener that might not have ever heard a coach or a trainer or anyone helping them in the physical health space, you know, talk about not only the pelvic floor, but your vagina, your whatever, like your stomach, your whatever, like it's destigmatizing, it's normalizing, like, okay, wait, we are not just all of this cannot just be about arms and legs. And so I think that's also something that you bring that's important, is like, we're going to talk about leaking because that happens to so many people. And if it's not happening to you, great. And if it is, great. Like there's no, I think even in just your naming of things and bringing this all to the forefront, it just normalizes, helps us put words to like kind of what our culture just shies away from, even when we are figuring out how to work on whole body health. Yeah, it's like you said, like bringing a name to it and making, like, helping people realize like they're not alone. This isn't something that just happens to you. Yeah. And then like giving hope, like, oh my gosh, like I don't have to like deal with this. Yeah. You know? And it's like you said, our culture is so like, you go to the doctor, you have your baby, you're cleared at 6 weeks, you're told, hey, go
Good
back
to
to
go.
everything.
Yeah.
There's no one, and I'm hoping it's getting better, but no one really says, hey, like, you should go to pelvic floor physical therapy, or, hey, there's someone who can help like bridge that gap between pelvic floor physical therapy and exercise, or even just like your doctor being cleared at 6 weeks in exercise.
Yeah.
So I do think like like you said, like it just shows people you're not alone, and then there is a solution. Like there is someone that can help you, deal with all of these things. You don't have to just deal with them.
Yeah, and you don't have to just walk into the gym and feel intimidated. Like, I think that happens a lot too, even with someone who's maybe been an athlete, or someone who, has done sports or been to the gym before. It is,
There's almost this mindset that like, oh, I'm an athlete, like I should be able to
I should know this, so
yeah.
I should walk in and I should be doing this and that. And there can still just be this overwhelming intimidation of like, okay, but I don't actually know how to do this in my current stage of life. It is actually okay for me to still feel intimidated no matter what. It is okay for me to be a beginner.
I think that right there is the biggest thing. Like, it's okay to be a beginner. It's okay to like we said earlier, go back and like lay that foundation. But I think that's one thing that can be like really hard for some people, is like, because I still identify as like an athlete, and it can be hard to accept like, oh, my body may need a little bit more, or, what's actually going to get me. Like, because our goal isn't just to work out today or tomorrow. Like, our goal is, at least I know a lot of people's, is to be working out when we're in 10 years, 15 years, when we're 50, 60. And so it's like thinking about, like, what can I do now to set myself up for that long-term, like, athleticism? But I think it's sometimes hard to think of it in the long term like that. Yeah. It's easy. It's like, what are we doing now? And it can feel for some people like, oh, like I'm having to go so slow, or I just want to like get back in the gym and like be lifting. I just want to go run 10 miles, or that's excessive, 2 miles, but, and it can feel like I'm never going to be able to do those things again. Like, I've lost that part of my identity. And so I think like really, and that's part of my job, is like helping people with that mindset of like, hey, like, this is a short period. And if we do take the time right now to take that step back, lay that solid foundation, figure out what's going on, and learning how to adjust exercises, that's going to carry over into the long term. Because, right now, maybe we're both postpartum, but in a few years, hopefully longer than shorter, like, we're going to be going into perimenopause. Then we're going to go into menopause, and that's like a huge influx of hormones that affects like the way our pelvic floor functions, or it can affect how our pelvic floor functions. And so it's like, if we've already laid that foundation, we already have the tools, it's going to make that transition just so much easier. Yeah. Right.
Which, again, those stages of life are also ones that are not talked about, shied away from. It's somehow...
Did you know you can go into perimenopause in your 30s?
Yeah. Like, it's somehow... it's treated almost like a secret or something you don't talk about, when it affects half the population. And I think there's also just... It's so little guidance. It's, well, this just happens. Meanwhile, like, every symptom under the sun is happening and changing the way your everyday life, and also the way you move, the way you communicate with your body, the way your body communicates with you. It goes into, this is like, it's happens, in the gym or in the, exercise space, and it carries through into, okay, how can you also do this in your life?
Yeah.
Whether it's, preparing for birth, navigating postpartum, or navigating menopause and perimenopause.
Yeah.
I want to go back to that moment when you talked about how learning some of these things can provide a space for hope, can engage with hope in a time that can often be filled with a lot of hopelessness. You get told, you leave that doctor's office or you leave that hospital and it's like, okay, bye. Can you speak more into that? How do you experience that come up when you're working with clients? What draws you to prioritize that in the exercise space, in the overall maternal health space?
Yeah. I think that I see this more in postpartum people, because like during pregnancy, like I feel like, okay, unpopular opinion, I think it's easier to navigate fitness during pregnancy because there's like a physical reminder, right? Like baby's inside of you, like I need to like take a step back.
Yeah.
And it's just, like, okay, I shouldn't use a barbell because I'm going to mess up my bar path. I shouldn't do a pull-up because my core, I can't manage the pressure, right? Like you can physically see that with coning.
Yeah.
And during postpartum, it's like that physical reminder. Yeah, you have your baby, but like the physical reminder like on yourself is gone. And oftentimes our brain feels ready, but our body's not. And that's something that's really hard to navigate and to accept, because it's like my brain's like, well, I'm not pregnant anymore. Like I feel like I can go run, or I can do X, Y, Z. But the reality is like if you just went through ACL surgery, there's no way that you would be like, I need to go run a mile.
Yeah.
There's no way you'd be like, I need to do a max front squat right now, because you just had ACL surgery.
Yeah.
And when we give birth, either vaginally or via C-section, like that's a major, surgery. It's like a major something our body has like gone through. And it's just like, but we, as a society, we're like, oh, it's fine. Like, just go back. Like, you're cleared 6 weeks. Like, you just go back and do what you do. Like, there's not a lot of guidance on like, no, like you just had like this huge thing happen to your body, and it's okay to like slow down. And in fact, you need to slow down and like prioritize your pelvic floor and prioritize your core. And for a lot of women, that can feel so hopeless and so like scary, depressing, very anxious. Like for me, for example, like, and I am thankful, like there is a little more information now. Like there are people that are doing like pregnancy and postpartum athleticism coaching. Like, but when I had my daughter, there was nothing that I could find. And I remember that like feeling of, I'm going to have to quit exercising because I am peeing on myself every time I do anything. Like I feel like I'm going to poop on myself. Like, and it felt like nobody really got it. Like everyone's like still working out around me. Like I see moms who have had like people on social media who've had babies who are like exercising. And I was like, what is wrong with me? Like, why can I like not, and I really got to a place where I was like, I'm going to quit exercising. Like, I'm getting a little sad, right? Like a little emotional right now because, and the thing is like, there is like hope, like, right? Like there is help. Like there's pelvic floor physical therapy. I'm a huge, huge advocate for pelvic floor physical therapy. There's now coaches that like specialize in exercise, and navigating, like returning to it after baby. And yeah, like my job is to like help you get back to exercise, right? It's to help you meet your goals, but also like a big part of it is like that mental health part, like that, like, hey, like I know it feels like you want to do all XYZ right now, and I know it feels like you're just laying here and squeezing your glutes, or like, you know, like I know it feels like we're not doing a lot, but like this is the first step.
Yeah.
Like tomorrow we'll do this.
Yeah.
And so it's like laying out that plan of like, we're going to do this, and then we're going to do this, and then in a month we're going to be here, but we have to be here before we can be over here. And that's like that's a huge part, because a lot of, it's called like athlete brain, right? Like a lot of people, it's like we forget this part, like, right? We're just like, oh, but we want to be here. And if we just jump to here, it's gonna really slow down our long-term like progress.
Yeah, like not only is nothing wrong with you, but also here's some things to hold on to while you feel like there is.
Yeah.
And it's normalized. It's actually okay, and I'm gonna verbalize and give name to and walk you through the process of step 1, step 2. We are actually going somewhere. Like the word that came up for me was should. Like I should be like that influencer on Instagram that looks like everything is the same or even better before, during, after baby. I should be getting those shots. I should just go out there and run that 10 miles. That, you know, there's this, it's everything. It's sadness, hopelessness. Am I going to lose this part of myself?
Yeah.
You know, something's wrong with me. And when you don't have a name for it, you don't know what to hold on to start to navigate that space. And so you're validating, you're normalizing, you're laying out the steps, kind of showing the light at the end of the tunnel, and saying, we can't rush to that light. We've got to walk there step by step. Thanks so much for talking about this. Can you also talk more about, you know, partners are along the ride for this process and they're affected differently.
Yeah.
And you know, how can dads, fathers, partners be supportive in this postpartum phase? And also, let's talk about how we're talking about maternal health, but let's also talk about paternal mental health and health. Like, I feel like dads are also not getting a lot of guidance and support in this stage.
Yeah.
So let's just start. It's a big, broad question, but let's just start wherever.
Yeah, I think that dads, like, have such a huge, like, part to play in this, right? Like, there's such, like, they're the ones who see mom every day at night when they're trying to nurse and it's not working, when baby won't sleep and they feel like they're about to lose their mind because they just want to sleep. So I think, like, when it comes to, I mean, obviously there's, like, a bigger conversation of, like, you know, postpartum depression, postpartum anxiety, and getting the right help with that, like, right? Like, just seeing people like you who can help with that. But I think that dads, like, really can offer support by, like, again, like, just reminding, you know, this is such a short stage. Like, I know it feels like this is so hard and, like, this is never going to end, but it will, right? And just, like, giving that constant support and reminder of, like, hey, I see you. Like, I see how, you know, like, all the things you're doing, and you're doing amazing. And I think, like, also, so I have a client right now who, she's very early postpartum, and one thing that her husband is doing is, like, I'm watching baby, you know, but, like, you know, making sure baby's all good and giving her, like 20 minutes to do rehab exercises. And it's like very little, like she's doing, you know, clamshells, glute bridges, like, but it's enough to make her feel like, hey, I moved my body. This is like, I'm doing my step one right now. And the support he's giving is giving her the space to do that.
Yeah.
But I mean, I really think that just like being there and seeing and validating, like, you know, like, yeah, you feel like this is your, you know, and even like, how do you say it? Like speaking to like the body image issues of like, you know, your body is different, but you just grew a human and it took you 9-10 months to grow a human. So it's okay if like it takes 9-10 months plus for you to feel good in your body again.
Yeah. Yeah. Being there, getting in it, witnessing, validating, you know, providing space.
Not minimizing. Because I hear that a lot. It's like, oh, you're just doing that. And it's like, you know, I just like pushed out a baby. Calm down.
Yeah. Yeah. And that this is a chapter.
Yeah.
And that the next chapter doesn't have to be going back to before. The next chapter is actually going forward to the new normal.
I love that.
Because that's the other thing.
That. Yes.
We talk about is like get back to, and it's actually like for both partners, for both parts of the parenthood team, it's in this chapter, and then our next chapter is new normal.
Well, and I think like, you know, I know, you know, we're talking about like working out and stuff specifically, but like whenever we think about exercise and stuff, you know, a lot of dads, like, I feel like they probably lose a little bit of their identity too, because now maybe they're not able to go to the gym as much as they used to, or, you know, whatever it might be. And so I think that is like also
they're
important.
Not used to training for the muscles that you need to move a car seat. Oh my goodness. You know, from the one seat to the other seat, like, right? Like, this is also, it's a new normal. It's a new, you know, I remember even having this, reminding myself when I'm rocking the baby to not do it like this. Yeah. Right? And to like, oh, okay, let me stand against the wall. Let me like get on my footing and then have my partner bring me my workout shoes so I can put on my nice supportive shoes while I rock the baby instead of, right? Like, so I think, there's lots of these little and big ways that, you know, just both people can be involved in helping each other through this physical, mental, everything change. And this, I mean, I think this way of talking about it through this specific lens of exercise and athleticism and working out is actually super helpful, because sometimes when we have these conversations, it's sort of so broad. Yeah. That there's not the things to grab onto. And this is so cool because there's things to grab onto. Like, okay, here's what we're going to grab onto. We are going to learn how to do, you know, I don't know the names, so you're going to have to correct me, but like, you know, how to do the wall.
Like a hinge.
Like, you know, and what that actually means. It's actually it's an anchor, you know, in a time where you're like, what the heck is about to happen.
No, so I agree. Like it gives you something like to focus
back
on
into that hope piece, you know.
Yeah. And being able to like physically, I think that's a big thing too, is like being able to physically, like you said, like you would do the hinges while holding baby, and it's like you can during that, like you can physically feel their glutes are having to work, right? Like, okay, I'm needing to focus on like keeping my chest up a little bit. Okay, what is my posture? So it's like I always tell people awareness, not obsession. I told you that too. Like I want you to become aware of your tendencies. I want you to become aware of your position. I don't want you to become obsessed. Like, and to be like, I have to do everything so perfect. Because that's like, you know, that leads into other, you know, obsessive, you know, things. And we don't want that. But I agree. Like, it does give you kind of something to hold on to, something to focus on. And then like again, a progression of like, okay, like I'm doing this and my glutes are working. Next week, I get to do this and they get to work more. And then the next week I get to do this. And then eventually, like, I'm back to a new normal for me. And I think that just carries on throughout life.
And then you're ready for that next transition in your life, whether it's an injury or a surgery or just the next, literally sort of the next chapter of life. And how feeling like a beginner, the next time you feel like a beginner, you're going to be a little bit more safe in that feeling.
Yeah, for sure. Yeah, because there's so much like with injuries and being like, it's very, I think, a similar mindset. But I think with an injury, like I said earlier, it's almost easier to give ourselves grace. It's like, well, I broke my foot. Like, I can't go whatever, right? Like, whereas a lot of times we just have literally pushed out a baby and it's like it's so much harder to give ourselves that grace. And I think a lot of it is things that we're seeing on social media, other people, and the fact that we're not talking about it.
Yeah.
Like, people aren't talking about like, yeah, I was like, really depressed, or yeah, like it was so hard when I felt like I wasn't going to get to exercise again, or, and so I think making that the norm, like talking about our experiences, talking about, how hard it was to not jump back into the gym, and then, but making not jumping right back into it more normal.
Yeah. There's so much trust involved. Yeah. And like, if we approach this in this different way, it's going to be okay.
Yeah.
And there's that little, leap that you take there. Well, thank you so much for coming and talking about this today, because it is so important, and I'm so glad that we were able to expand on all the different aspects to it. And we can't wait to have you back one day.
Of course, I would love to be back. Thank you so much for inviting me on.